Welcome, everyone. It's great to have you here at the webinar. And I wish you a wonderful time with us and learning more about the Foundational Helping Skills manual. Over to you, Ken.
Great. Thank you, Fiamma. And hello, everybody, and welcome. It's a pleasure to be here with you today. So I'm Ken Carswell. I'm based at the Department of Non-Communicable Diseases and Mental Health at WHO HQ in Geneva, where I lead our work on psychological interventions and digital innovation. So I just want to say a few words at the start of this important event, which aims to support dissemination of the Foundational Helping Skills manual. So first of all, and on behalf of WHO, I'd like to thank MHIN for hosting this webinar. I would also like to thank all of the colleagues who have contributed to the development of this manual. It's really been a team effort over a number of years, and many people were involved. Some of the key partners who gave a lot of time and a lot of effort to its development include War Child Alliance in Jordan, Transcultural Psychosocial Organization in Nepal, Socio en Salud in Peru, and in Uganda, Health Right International, Makerere University, and the Butabika National Referral Hospital. Many others are involved as well, and you can find them all in the acknowledgement section of the manual. And we're hugely grateful to everybody who's been involved in this effort. And of course, I'd like to thank the EQIP team, which including WHO, includes colleagues from UNICEF and George Washington University. So thanks to everybody. Now, I'd like to just set the scene a little bit. As we all know, around the world, there is a huge gap when it comes to mental health and psychosocial support. The reality is quite stark. The need for care hugely outweighs the number of trained professionals and people who can provide it. And this gap matters because when people are struggling, they often don't turn first to a psychologist or a psychiatrist or another professional. Instead, they may turn to those already around them, a trusted teacher, a community health worker, a neighbor, a volunteer in their community, and similar groups. And these are often the first lines of support, and the way that they respond can make a profound difference. And that's where this new WHO UNICEF Foundational Helping Skills training manual is so important. It does a number of things. So firstly, it helps expand access by equipping more people beyond specialist professionals to provide safe, compassionate support when it's needed the most. Secondly, it helps to build trust and quality. The manual takes a competency-based, evidence-informed approach and helps ensure that helpers respond in ways that are effective, consistent, and respectful. Thirdly, it scales impact. Its flexible design means that it can be integrated into existing trainings across many sectors: health, education, child protection, pre-service university education for professionals, and many more. And finally, by training up people who are providing help in these skills, it can help foster connection, resilience, and hope, and help communities to thrive. Now, what makes this manual different to similar manuals that are out there is not only the use of the competency-based assessment, but the way that it's been arranged so that the key skills that are needed by different groups of helpers can be selected and trained. And this really makes it relevant for anybody who is in a role where they may need to support people in distress. So really, the key takeaway is that the manual isn't just a tool, it's a pathway to support the skill development of all helpers. And in turn, this will help us reach more people in more places and provide people with the care and dignity that they deserve. So with that, I would like to say thank you for attending, and I look forward to the rest of the session, where we'll explore how you can use and adapt this manual in your own work and contexts. So thank you for your time and for attending, and I hope you enjoy the session. Thank you.
Thank you, Ken. And now I would like to hand over to Anne from UNICEF. Please go ahead.
Thanks. Hi, everyone. Thank you so much for joining. I am Anne Wilhoit with UNICEF headquarters. I lead our mental health and psychosocial support team in child protection. We are just thrilled that the manual is coming out finally. For those of you who have been asking for a long time for this type of a manual, the Foundational Helping Skills manual, as Ken said, builds a competency-based approach to these foundational helping skills. And this hasn't just come out of nowhere. It's come from an entire wonderful collective collaboration. And so big thanks to WHO, to George Washington, to Mental Health Innovation Network for hosting today. But most of all, to all of you and all of the partners around the world that have made EQUIP and the Foundational Helping Skills Manual what it is today. This actually came from, what are we at, 6 years now ago. We were having talks and lots of conversations about what the biggest gaps are in the field. And from conversations with hundreds of people, the biggest thing was trying to make sure that we have the workforce, the quality of the workforce, because we're not paying for buildings all the time. We're not paying for vaccines all the time in MHPSS. Our tools are our people. Our tools are you. And so this resource came from people saying, what we need is a way to make sure that we have the competencies in our workforce and that very beginning level training to make sure we're all on the same page. So we have so many psychological interventions, psychosocial interventions, even psychiatric interventions out there. And people were saying, great, what we really were hoping for is a training before all of that to make sure that we have the competencies that we need for that foundation to build up all of the other competencies on top of. And this came directly from all conversations with people around the world and with many of you. So this Foundational Helping Skills Manual has gone through lots of iterations, lots of feedback from many of the people on this call. We were very close to publishing it multiple times, and now it's finally here. So we're very happy to be hearing from our colleagues here on the panel about the way that it's been created, and also hearing from people who are implementing it. And moreover, we'd love to hear from all of you as we keep going. I think we can use the chat, and there's Q&A, and please find all of us after this webinar as well to continue to have the conversation and work on implementing it around the world. It's useful across all different disciplines, all different professions, very, very versatile intervention, which we're happy to have here today. So I'll hand it back to Fiamma. We're so glad you're all here. Thanks so much.
Yeah, thank you so much, Anne. And I will hand over to James now, who will provide a quick walkthrough of the manual so that you know what we're talking about.
Thank you, Fiamma. I'll just share my screen. And just to reiterate what colleagues have said, thank you so much for joining us, and thanks to many on the call who were integral really in the development of this manual, which has indeed been a long time coming, and so great to see so many people on the call today. I encourage you, firstly, I guess, to take a look at the manual, download it. The QR code here should direct you to the correct website where you can download it. At the moment, it's available in English. It is released on a Creative Commons license, so it means that if people are interested in translating, please get in touch and we can support you with various resources if you were interested in taking it down that route. So I'm just going to talk briefly through the manual, the kind of features from it, where it's come from, a bit of its background. And Brandon a bit later is going to talk more about its development and some of the science that's gone into it. Obviously, as represented here in this webinar, this has been a real joint effort. It's published jointly between UNICEF and WHO as part of the joint WHO-UNICEF EQUIP initiative. And just to say, in terms of the background, at first I'm going to talk a bit about the broader context behind this, and then a bit about EQUIP, and then go into more details on the manual itself. But I guess I wanted to point to this publication here, but I think this is replicated in other publications as well. So this is the World Mental Health Report from 2022, where it's very clearly identified that some of the skills in this manual, well, many of the skills in this manual are really key for mental health professionals when delivering any kind of support, really. But more than that, these, if we're going to meet the mental health need that Ken's already talked about globally, we are going to have to really build the skills of others that people come into contact with. People perhaps without a professional mental health background, but can still provide really effective, really essential care. And again, these foundational helping skills, which can be called lots of different things and are in this manual, are still really key in terms of development of those skills so they can provide effective care. And if we're going to train people, if we're going to supervise and support people effectively, what's really well established now is that we need to take a competency-based approach, which is what this manual encourages. And also it's very much what Equip is all about, really. So Equip, which is the kind of overarching product that's led to this manual, is really a set of resources to support trainers, support supervisors to develop a competency-based approach to their training. And by competencies, we in Equip are talking about those, it's a collection of our knowledge, our skills, our attitudes, and how those are demonstrated through our behaviors. So really we're talking about what people are doing, the actual practice of engaging with others and looking at that and understanding that and really taking notice of that so as we can support people's development to really provide effective care. So Equip has a number of tools to support this approach. Central to them are what we call competency assessment tools, which is when you're training, they really help you to identify whether someone is displaying a competency or perhaps that they haven't quite developed that competency yet and what they are displaying and how they might develop that competency. So it's really a range of tools that help you to do that. And central is the tool Enact, which is about basic helping skills, foundational helping skills. And it's from this tool that this training manual was developed. And I'll talk a bit more about the different competencies and skills involved in it. And just very quickly on Equip, everything on Equip is available freely on an online platform. You can download all these tools and different resources, or you can use them on the platform themselves in a digital form. Again, here's a QR code in the website so as you can access that platform. We'll try and put all these resources in the chat as well so you can easily access them. And Equip helps because using these competency assessment tools, you get to identify your trainees' strengths, where are they already really good, and you start to also identify areas where they need a bit more support. And then by seeing that very clearly in a very detailed way, you can have discussions with your trainees on how they can improve. So now we can have very focused, very detailed discussions about concepts that might previously have been a bit nebulous, a bit arbitrary, a bit difficult to pin down, and really help people to think about how they might develop those different competencies. And you as a trainer can start to customize your training and supervision. So as you're really targeting the areas where your trainees need most support. So what we've seen when taking a competency-based approach to training, and again, why I'm talking about this is that the foundational helping skills training package that we're going to introduce here is a very competency-based approach to training using the Equip approach. What we've seen is that we see really quite a sizable increase in helpful behaviors if you've had a competency-based approach to training. So that is, you're assessing your trainees and their competencies, and you're providing feedback on those competencies. And I think very importantly, what we're also seeing is a reduction in unhelpful behaviors, which is really quite unique to Equip, and I think really important if we are following do no harm principles as well. And the quote from the side is from Josephine from Health Right Uganda, who was very central to the development of a lot of these resources. And she and a number of others have told me that using Equip, it really helps their trainees, yeah, but it helps them as a trainer. Because when you're training someone, it's very complicated, all the information that you're seeing and difficult to really focus in a systematic way. And using these tools really kind of gives you those grab rails, gives you that support to really be a bit more structured about how you train, how you provide supervision, how you provide feedback. Yeah, just a bit more objective as well. In the way they do it. This is just one kind of piece of feedback. There's been lots of different feedback we've had about the benefits of using this training, but I just wanted to give you a quick flavour of it. So where does the foundational helping skills training package fit within this? So foundational helping skills, we can call them lots of different things, and many people here do probably call them lots of different things, and we think that's absolutely fine. It's trying to find a unifying term, I guess, that brings all this together. So we're talking about basic helping skills, psychosocial support skills, common therapeutic factors is often what they're called, general principles of care. And again, what we're thinking about here is those observable actions, so the things that we're doing when we're working with someone that really strengthen that connection between the helper, the help seeker. And why we call them foundational is a lot of the research shows, and Brandon will go into this, a lot of the research shows that these are really necessary qualities in any kind of interaction with someone. Classically, they're talk common therapeutic factors in more psychological therapies, but they're also really crucial to lots of our different interactions. And some of the skills they cover, I'll actually show you a diagram of those, but we're talking about things like your communication skills, your ability to establish empathy with someone, the ability to establish a confidentiality agreement with someone, maybe manage risk, that sort of thing. And we see these as skills that are really, really helpful and really essential across all sorts of different roles, whether that be, obviously from WHO, we're really focused on health sector, but we obviously recognize the importance of a number of different sectors in supporting people. So could it be education, social services, et cetera, et cetera. It's really broad, I think. Frontline providers, all sorts of different groups. So let me just quickly show you all the different skills that we're looking at. So we're looking at 15 different skills. So non-verbal, verbal communication, confidentiality, et cetera, as I've talked about. And in the manual, we've grouped these skills according to what you're trying to achieve when you're using these skills with someone. So whether you're trying to engage with someone, build that kind of rapport and that alliance with someone, whether you're using these skills to really understand and assess someone's position at that moment, or whether you're starting to use skills that start to support someone as well. Now, the manual itself takes these different skills and groups them into 8 different modules. The manual has 9 modules, actually. We have one kind of middle module, thinking more about your role as a helper, but it groups these according to 8 different modules. So the idea being, it being modular, you can pick and choose which you think are most appropriate for the people that you're training, or that most fit into the approach that you're using, and then use the resources within the manual to train effectively. So some of the key features of the manual beyond that, I just want to reiterate that we see these as being a manual for trainers and supervisors. It's not, and it's for trainers and supervisors that already have a bit of a background in some of these skills. So they themselves are aware of these skills, and it's more to assist in the training of them. So not so much a manual for a helper directly themselves to train themselves to use. It's really a resource for supervisors and trainers to use. We see this as actually having applicability for specialists and non-specialists. So we've worked with universities who have been interested in using some of the equipped resources, and many students have often been very interested in more advanced therapies, particularly if you're, say, a clinical psychology student. But I think what's been shown is actually often what people need, and certainly at first, are these foundational helping skills, and these resources can be really helpful in that kind of educational setting to kind of strengthen an existing course. As I think I've said quite a few times, the manual is competency based, and by that I mean that there are moments in it when you're doing competency assessments and providing feedback to your trainees, and I'll go into that in a bit more detail. As I said, it's modular, so you can pick and choose which of these different modules you want to teach. You might want to do them all together, and I think we'd say it's about a 3-day training if you want to do them all together, but you could take a few and say, look, we want to focus on non-verbal communication skills, empathy, confidentiality, and risk at first. We want to bring that into an existing training, and then we can build from there into other skills. The manual itself incorporates lots of time for feedback. So I think a really key thing with the equipped resources is that they're helpful when you use them to provide feedback. They're to support you as a trainer to have those really concrete discussions with your trainees that support them to develop. And it's really about development. It's not about scoring. It's about supporting someone to develop their skills, their competencies. The manual is really based on lots of role plays. It's very interactive. We see that as crucial if we're developing these observable actions, and can be integrated into an existing training or other educational program and adapted, and if needed, delivered remotely as well. And just a quick look at the manual itself. So this is a few screenshots of one of the modules. You'll see here, module 1 looks at your communication skills, your non-verbal and verbal communication skills. Initially, you'll get a bit of an outline of what the module will contain, how long it will take, the materials you might need. And then the manual will take you through step by step different activities that you can do to introduce these concepts to get your trainees practicing these concepts. And then at the end of each of the modules is a kind of informal role play. So you'll get your trainees sat together, maybe in pairs of 2 or 3, get them role playing the skill. There'll be very detailed instructions on how to role play that skill. And you as a trainer can walk around and sit in on 1 or 2 groups using the competency tools, which are included in the manual, just to kind of informally assess and see where your group's at. And then at the end of the training is time spent to do individual role plays with your trainees, where you can give much more specific, concrete feedback to that individual. So that's built into the training as well. And obviously we've given very suggested activities, role plays here, but we'd expect trainers to take this and use this and adapt it to their context, kind of come up with much more relevant examples for themselves, build role plays that are much more specific to your specific setting, your service setting, your context. If people want to introduce other activities, they can as well. These are really here as a guide, as a starting point that people can build from. Just a quick comment on the tools themselves, what you'll see here, and we have more resources to support you with using equipped tools. What you'll see in the middle are the behaviors when you're assessing people you're looking out for. So we call these behavioral attributes. So you'd run a role play and you would be assessing. So you will, 2 people, 1 person will be role playing the client, 1 person role playing the provider, your trainee, and you're looking out for these behaviors. And if you see any of these behaviors, you tick them off. And then that helps you to get a sense of where your trainee is perhaps needs more support. So perhaps they're engaging in other activities when they're working with someone, and their discussion needs to be had about that. But perhaps they're really good at, using supportive body language, maintaining appropriate eye contact. So it gives you a real detailed sense of what's going on. And you can score these to look more at a group level at where some of the needs are and where some of the strengths are. So that gives you much more of a group sense. So just to summarize, EQUIP is really about reducing harm, improving quality of care through competency-based approaches to training. We're really focused on trainers, supervisors across a range of sectors. The tools that we're delivering here, including this foundational helping skills training manual, has been based on, well, I think it's important to say, as Ken has said, it's been based on the work of many people in a number of different locations testing this out. And there's been systematic literature review to develop these resources themselves. And the results have shown that they are associated with improvement in the development of competencies in trainees. The manual itself is a very detailed competency-based approach to using a specific EQUIP tool, the ENACT tool. And you can really take this course and start to flexibly apply it to everything you do. Okay, thank you. Back to you, Fiona.
Yes. Thank you so much, James. Before I hand over to Brandon Ruta from George Washington University, I just saw in the chat that everyone is so excited to get this manual, which obviously we are very excited too as well for that, and asking for all the different beautiful languages. Just to say that for now, we have it in English, but of course we would like to support or even maybe see ourselves how we can support with other languages. But just to say, we have also a lot of resources on the website, which Anne already sent one link, and Ruth, I think, as well. Under resources, you can see if there are some resources, maybe like the assessment tools that are interesting for you as well. But for the manual itself, for now, it's only in English for those who have asked for all the different languages. So just to clarify, but that there are more resources on our platform under the resource tab. Okay, so thank you so much. I'm handing over to Brandon and Ruta for the development of the FHS and some evidence that supports its use. Go ahead, please.
Great. Thank you so much, Fiamma. I'm just going to make sure I'm in the right presentation mode. Give me 1 second. All right. So I'm delighted to share today about the development work. So this is a presentation jointly from colleagues at George Washington University, including Ruta Rangel, and also acknowledging Gloria Pedersen, who was instrumental in a lot of the early development of the FHS materials. So as Anne was sharing at the beginning, some of our very initial work was focused on conceptualizing what EQUIP needed to be. And at that time, in May of 2018, there was a theory of change exercise in Geneva, and Alison Schaefer came up with the overall framework that really led to guide us on how best to implement these activities. And at the center of this practice was really thinking about a resource that would be freely available for anyone in the world to use, that would really walk through these ideas of how to teach the foundational helping skills. It was identified as a major gap because although there was an increasing number of specialty interventions and kind of step-by-step approaches to be able to do different psychological skills, that those basic skills that we use to support one another, there was not a widely available resource to be able to address that. More about the development can be found in a 2025 Lancet Psychiatry article, and the QR code is available here. So as James was talking about, this concept of foundational helping skills is something that has been central not only to psychology, but to many fields of medicine, of nursing, and of different helping approaches across sectors. They've been called by different names. So another name is common factors, and they're also called non-specific skills. So these are not skills that are needed for a particular intervention, but really are cross-cutting. So at the center really are good communication skills, being able to do active listening, open-ended questions, summarizing, clarifying statements, really genuinely demonstrating empathy, being able to understand another person's experience, validating and normalizing those emotions, and having a warm relationship. And then leveraging that empathy and good communication to develop a collaborative partnership in whatever field of helping you are in, whether that's social services, case management, a nutrition program, surgery, and of course in the mental health field. There's extensive research even prior to the EQUIP initiative showing how important these common factors are. So one is that they are cross-cutting in different fields. Another is that they really help to promote hope and supportive behaviors. So the idea being that when someone displays these foundational helping skills, it encourages hope in the person who is seeking care and helps as a behavioral change motivator. Now, in studies that have been conducted in the past, what we've seen is that when a helper in any field displays the foundational helping skills, they're able to elicit more engagement in care. That individuals who have a helper who has these foundational helping skills are more likely to come back again and again and stay engaged in whatever form of support or treatment is being provided. Secondly, it really increases the motivation of clients to be able to engage in healing, getting well, and other forms of social services. It is more effective for information sharing and openness, that we acquire more accurate information when we are empathetic and have good collaborative communication skills. Without those skills, individuals are unlikely to open up with us and be able to share what is going on in their lives. And because many of us deal with stigmatized health conditions and experiences ranging from gender-based violence to sexually transmitted infections, and of course to the often stigmatized field of mental health, really developing that open communication is central. There's overall greater trust, not only with that individual, but then also with that organization that in which they work. There are more positive client outcomes across fields, and this even extends to things like surgical procedures. When a surgeon has good communication skills, or their nursing staff or assistant staff, we see actually better recovery even from surgical procedures. And at the end of the day, the heart of EQUIP really is about reducing harm. At a minimum, we want to make sure that we are not introducing something that could be non-beneficial or potentially harmful to an individual. And so that's central. When individuals have these common factors, they are much less likely to contribute to harm. As Ken was sharing in the beginning, a lot of our work, and for many of you on the call, is focused on trying to get more individuals who are not coming from a highly technical clinical background. not clinical psychologists, not psychiatrists, not licensed clinical social workers, but really the idea that we can train anyone to be an effective helper. And there's increasing research that when we're dealing with individuals who are not specialists, that these foundational helping skills, also called non-specific elements here, are actually the most important aspects of producing a positive outcome. In a review conducted by Daisy Singla in 2017, she found that actually the non-specific elements contribute twice as much or even more than that than specific treatment components like CBT or behavioral activation in generating positive mental health outcomes. So as Ken and James were also sharing earlier, there was work that predates the EQUIP platform in terms of developing a common factors assessment tool, the ENACT tool. And just to let you know here that went through a very rigorous process looking at over 56 tools that were used around the world, but really developing something that anyone could pick up and use and would be relevant not only to specialist providers, but also non-specialists in mental health and anyone in the helping field. Over time, this has evolved, and this is the figure that James showed earlier, into our 15 core foundational helping skills. And this is really how we designed the FHS manual, was to build from engagement skills, those to help you start a conversation and build some trust, to then understanding, learning what that person is going through, and then ultimately to supporting. But it is built in this tiered hierarchy. And for some individuals, maybe just the engagement skills are most important. For others, all three tiers may be very relevant. So it was important for us in the EQUIP team to not simply kind of come up with a manual, have it driven by theory, but not have it tested in real-world settings, delivered by some of the leading organizations and best trainers around the world to get feedback on, does this actually improve what they are already doing? So as was acknowledged earlier, this was important work done in collaboration with Transcultural Psychosocial Organization Nepal, led by Pragya Shrestha, Health Right Uganda with Josephina Kellett, and Socios in Salud with Carmen Contreras, who you'll hear from more in a moment. So in each of these organizations, there was an implementation of the FHS approach to training, and our colleague previously at George Washington University, Gloria Pedersen, led an extensive both quantitative and qualitative evaluation to see if this was working. There were two pieces here that were relevant for us. One was, did the content make sense? Were we including enough, but not too much information to be easily trainable across something like a 3-day period? But also, as was discussed earlier, how feasible was it to check as you go and see if people are actually learning the competencies to make decisions about how much time you spend on something like empathy versus maybe putting additional time into confidentiality or suicidality or other types of foundational helping skills. And what we found was that this flexible approach was quite feasible. And it's so important for this type of training because everyone comes in with a different set of skills at the beginning. This isn't something that's brand new to everyone. People are going to walk in already with some good communication skills, or maybe being empathetic, or having prior experience in, say, engaging families. So what we wanted was a very tailorable, modular training approach where trainers could easily check as you go if people were acquiring these skills. And that way we can see that in some settings, the training might be shorter because people come in with a lot of experiences. In other settings, you might need more time because people don't have as much of a background. But this meant that this was easily adaptable to many different types of trainees across settings. So we looked quantitatively just to be able to be sure that we were actually seeing an improvement in helpful skills. And we found that across all of these piloting field sites, that helpful skills went up. But even more important, as I was sharing earlier, we really wanted to see that this type of training not only improves helpful, but actually reduces harmful behaviors. We want to see that at very minimum, after going through this training, a person is less likely to be, say, critical or dismissive or unempathetic or judgmental. And what we see was across the board in every setting, there was a dramatic reduction in these harmful behaviors as well. And that's so important if we're going to go into a health service, if we're going to go into some other community service, that we're at least reducing harm. And the manual is very effective and targeted to be able to do this. We got a lot of qualitative feedback as well. And what's really great, and we'll hear from Carmen in just a moment, is one of the key groups that we actually tried the foundational helping skills training on was with obstetricians and gynecologists. There is a lot of research and findings around the world that when obstetricians and gynecologists do not have some of these basic communication skills, that their patients actually have worse outcomes. There's less collaborative decision-making between a mother and an obstetrician around delivery practices. There's less education that helps the mother in the recovery period and in caring for her child going forward. And also in terms of a host of other reproductive health issues. So obstetricians are a group who could really benefit from improvement in these foundational helping skills. And what was striking to us was that we would hope the obstetricians would get better at communication, but also how much the obstetricians took on more attention to mental health needs. And so this is a quote from one of the obstetricians in Peru who was saying that she didn't have a habit of bringing up the topic of suicide, but that after going through this training, she actually felt comfortable opening up the space to discuss self-harm with the women for whom she cared, and that she even got text messages in the middle of the night, people trusting her and following up and sharing about their suicidal thoughts, from which she was then able to connect them and help get care. And often we have so much hesitation talking about suicide and reducing self-harm that this manual is a way to step into that space and make us realize that every person can talk about this in a way that can be helpful with appropriate referral services and supports in place. We also found that other individuals in the nursing space understood they could actually get better histories from their patients if they had better communication skills. And I especially appreciate this quote from the Health Right Uganda team and feedback from a community health worker, a member of a village health team, who said, after going through this training, she said, I'm going to be fulfilled because I know I did the right thing, not just because of the profession, but as a human being. And that's really our goal here, is to help people connect with others and use these basic communication skills and empathy to really be able to develop those trusting, supportive bonds with one another. So just to share a little bit, this manual, as many of you have seen, was only recently published, but there's been a lot of interest and uptake. We've been working with Healthy Blue in North Carolina, which is associated with an insurance provider, and they're already, as we speak, training 500 family case managers in these foundational helping skills so that they can better support parents who are supporting children that have a number of health conditions. Gloria Pedersen, who is now with Partners in Health, has been training a lot of their organizations around the world to be able to integrate this. They just recently completed a training with the Partners in Health psychiatry residency supported program at Kisi Hospital in Sierra Leone. And even the psychiatrists felt like this was important training for them and helped them with these communication skills. So we even see that experts are benefiting from it. And a colleague, Han-Hui Chen at the Tianjin Mental Health Hospital has also expanded on a very broad scale, integrating foundational helping skills training with nurses, and then also individuals in employee assistance programs. So with that, I would like to switch over and share a video from Carmen that describes her very impressive work. So let me just do that in a second.
Buenos días, buenas tardes. Mi nombre es Carmen Contreras, directora del Programa de Salud Mental de Socios en Salud Perú. Nosotros empezamos en el currículum de habilidades básicas de salud mental porque sentimos que ha sido una herramienta muy poderosa para fortalecer de manera didáctica tanto a los psicólogos como las agentes comunitarias que intervienen en nuestros diferentes proyectos y programas que brindamos en Socios en Salud. Nosotros pensamos que una capacitación vertical podría ser suficiente. pero cuando conocimos el paquete de habilidades básicas de ayuda en salud mental, todo cambió. Porque nos dimos cuenta que algunas personas llegaban con algunas competencias y poco a poco esto iba cambiando. Entonces, creemos que fortalecer las competencias para el inicio de alguna actividad en la comunidad es sumamente importante. Nosotros iniciamos este paquete de entrenamiento a través del roleplay. Las dramatizaciones que nosotros realizábamos durante la capacitación fue algo muy importante. Entre el juego, entre el dramatizar, se creaba un vínculo mucho más fuerte entre capacitado y capacitador. Nos ha gustado tanto este currículum que además de tener capacitaciones presenciales, tenemos una plataforma virtual donde hemos incluido el paquete de habilidades básicas de ayuda en salud mental. El nombre es Tobuti y cualquier persona que acceda a este paquete, cualquier persona que acceda a la plataforma podría acceder también a este entrenamiento. Nosotros, en Socios en Salud, estamos trabajando mucho desde hace 5 años en la intervención Pensamientos Saludables. De ahí que nuestra intervención, tanto en médicos, enfermeras, obstetrices, psicólogos y trabajadores comunitarios de salud, incluye el entrenamiento con habilidades básicas de ayuda en salud mental. Una de las recomendaciones que yo brindaría es que esta intervención, este entrenamiento pueda ser a través de diversas organizaciones públicas, privadas, y también deberían de incluirse en las universidades para que los estudiantes, una vez que salgan a su trabajo en los servicios de salud, puedan incluir todas las competencias que este currículum nos ofrece. Muchísimas gracias.
Thanks. Back to you, Fiamma.
Oh, okay. Wasn't sure if you were still presenting something else, Brandon and Ruta. Okay. Wonderful. So thank you so much, Carmen. That was such a beautiful and practical insight. We will have now 10 minutes time for our Q&A, and I can already see that there are a lot of questions in the chat. So I don't know, James, you were saying that you and Ruta want to identify questions, or
Yeah, I think so. I just wanted to make a first point on translations and maybe elaborate on the point I made at the beginning of my presentation. So this manual is published on what's called a Creative Commons license. So that means that anyone can take it, can adapt it, can translate it for themselves within the terms of the license, which basically say things like you can't use WHO's logo or UNICEF logo, you can't sell it for money and things like this. So you're free to translate this and adapt this as you see fit. It's really helpful for us if you actually email us and tell us that you're interested in doing that, because there might be different people that are interested in translating it into the same language. And we can then coordinate that a little bit. We can provide you with materials that can support the translation process, Word documents, some kind of guidelines for doing it as well. And then we can also put that up on the website so people can then have access to your translation. So in the manual itself, there is details on the email that you need to email, which I'll pop in the chat here. It's the Psych Interventions email. So just to say, if you're interested in translating, please get in touch with this email, and then you'll get some more information about next steps to take. Okay, thanks. So yeah, I think we could just go through the different through some of the different questions, if that's okay. Let me just pop this in the chat.
maybe also to say, oh, sorry, as there, I don't know if we want to highlight one of the questions that were asking about the feasibility of it with non-specialists. Do we want to maybe address this first, as this is
Yeah, I think that would be a good one to go to first. Yeah, absolutely.
Yeah, should we do that? To highlight that this has been really, this is evidence-based and has been worked through with many different contexts, many different sectors, and that it's supervised and trained non-specialists. So it's not that we're giving or handing over the work and the manual to just anyone who has never heard of it. But I think it's important to say that, that those are trained and supervised so that we reduce any potential harm, which of course is true if there are non-specialists and that have not been in touch or working in that realm, that this could happen. But yeah, as they are trained and supervised, we have not encountered such situation yet. I don't know if anyone from the team wants to add anything to that. But we are definitely very happy to have critical questions because that's important. That's how we improve. So thank you very much for bringing this up.
Yeah, thank you. Should we work down the questions that we have in the list? I can see Brandon's typing an answer to one at the moment, so I might skip the first one for now because I think Brandon sent an answer. So I'll go to Victor's question, and maybe I would actually direct this at you, Brandon. How can foundational helping skills training be adapted for Nigeria, where direct eye contact and certain body language cues encouraged in the manual may conflict with local norms of respect, especially towards elders or authority figures? I think it's a really important question about adaptation.
Thank you so much, Victor. And this is a really, really important issue that we've thought about since the initial development of ENACT and the development of the role plays and the training around foundational helping skills. So an important thing with this is these types of trainings are intended to be taught by individuals in those settings themselves. We're building materials to really expand the workforce and make sure that those individuals acting in those settings, familiar with those settings, can pick up this manual and use it. Similarly, those individuals are the best judge of what our culturally appropriate body language is, what culturally appropriate verbal exchange is, what are culturally appropriate ways to talk about how a person understands a health condition and some of the beliefs around that. So if you look at the tools we use to evaluate, we don't say that a person must have eye contact, because in some cultures that would be inappropriate. Also, it varies between age and gender, different forms of status and hierarchy. The same thing goes for physical body language. So in an American clinical setting with, say, high income, predominantly, let's say, white populations, we might have a lot of emphasis on eye contact, but a very low emphasis on physical contact. No touch, no touching allowed. In other cultural settings, that could be very inappropriate, that eye contact actually should be minimized, but some form of physical contact, some physical touch is very appropriate and healing and supportive. Again, taking gender, age, and those types of factors into account. So when you look at the tool, it's phrased as what is an appropriate level of eye contact and what an appropriate level of physical contact. But those individuals working in those settings are the judges of that. We and WHO and UNICEF are not those judges. So clearly you already have thought a lot about this. So I think this would be a great tool for you to adapt for your setting.
Great, thanks, Brandon. Okay, I'm assuming, Joy, that people can't, that the participants can't speak, or can we ask them to talk through their question?
If they raise their hands, we can, and I'll be able to unmute you to answer the question.
Because the next one would be from Yothi. Hello, dear colleagues. Could you please speak a bit about the training requirements and possibilities of independent use of manuals? I can see it might not be as effective as combining with a live training. I thought it might be used just to elaborate a bit on that, Yothi, so we can answer that a bit more fully if you're able to speak up. Is that possible? you're still with us.
And maybe as we are waiting for Yothi to speak, there's one more comment from Gary Belkin, and I just wanted to say that actually I've worked with the government in Ivory Coast, because you were saying, right, that other civic leaders or even politicians might also benefit from these skills. And just to say, we have been working with governments, and so the government of Ivory Coast, together with UNICEF, was actually working on a government-wide and nationwide training for MHPSS and for the different ministries. So that's a great point, just to say that this is also already happening. So I
Thanks.
don't know if Josie can speak.
Yeah, I think Joy needs to possibly have to speak
Yeah,
now.
I've enabled.
Do you hear me?
Yes, we can, yeah.
Oh, great. Hi. Thanks so much for this presentation, colleagues. I'm really so excited that this has finally come out. The question is really around, so we're having a few discussions around generally including EQUIP as part of higher education institutions and how various professors are able to support students. The question really is, there is a lot of demand, of course, for resources that can be very independently used, because oftentimes there might be issues with time being given for trainings, etc. But I just wanted to, I see the value of course, using this manual in a live training as it happens with EQUIP, but I wanted to see what are the possibilities of some form of independent use for groups of professionals to try it.
Okay, that's an interesting question. I might go back to you again, Brandon. Do you have any experience of people delivering this training with independent use?
So what I would emphasize, and thanks for bringing this up, Jochi, is that the idea from the beginning is that this can be either standalone, but actually in many instances, it's complementing something that's already done. So for example, you have a nursing curriculum, or you have a specific intervention curriculum like CBT or Problem Management Plus. Both of these are very feasible. And one of the things I would say is which modules you choose should be decided upon based on the curriculum. So for example, we've also worked with Makerere University in Uganda, and they don't do this whole training just in like a one-off kind of 3-day thing, but they scatter it about based on the curriculum needs for different sectors as a way to build upon any theory that they're teaching or didactics or practicum experiences. So it's a little bit of a menu in some ways to be able to decide what you want to use when, but also if you look at the way that it's framed, the off-the-shelf kind of easy to pick up and run with would be a 2 to 3 day training on its own. And also because we've tried to write the language as general as possible, it shouldn't conflict with other things and really be complementary to them.
Yeah, that's helpful. Thanks. I also wonder if maybe I could ask Carmen, in your use of this manual or these materials on foundational helping skills, when you're training your staff, do you have any self-learning aspects to that training? I don't know if that's easy to understand. Perhaps not. Okay. Maybe for now I'll move on, but maybe we can think about that question and come back to Carmen. Yeah. Okay. I'm going to go down the list. I hope that was somehow helpful, Yothi. In terms of existing trainings on this topic, particularly in Arab countries such as Iraq, we're not aware of trainings on this topic. I think MHPSS Academy do lots of training for those contexts. We'd encourage anyone who has skills already to pick up this manual and support training in places in Arab countries such as Iraq. Yeah, I don't know if anyone else has got any thoughts about that. Maybe they can pop it in the chat because we haven't got much time for questions.
Yeah, James. Oh, sorry. Maybe just to say that UNICEF is continuously actually working with emergency situations. So if you have any questions, you can also contact us because, yeah, you can use it in emergencies. There are other versions for emergencies being developed as well. But this manual you can also use in emergency. We have actually done that before. So, yeah, it is really versatile, so to speak.
This next question on, please clarify whom the FHS manual is for. Organizations working with youth frontline workers delivering programs for adolescents. Is it a manual for youth, or is it for the trainers and supervisors who manage the youth frontline workers? The manual is for training people who are working with adults principally. UNICEF are working on a manual for people who are principally working with children and adolescents. Of course, many of these skills can be helpful whoever you're working with and can be supportive, but really it's focused on people who are working with adults. I hope that's clear. So anyone over the age of 18, really. I'm gonna jump to a question for Anne, if that's okay. And Fiamma, actually. Have you compared, how would the manual work with UNICEF's Caring for the Caregiver package, or similar? So I guess the question would be, in terms of integrating this within an existing UNICEF package, how would you see that working or not?
Thanks. I'll start and then Fiamma, feel free to jump in. But in terms of Caring for the Caregiver, so that is a package specifically for parents and caregivers. And so it's working even on their own mental health and well-being. So this would be then to support the people who are implementing Caring for the Caregiver and on their own skills and their own foundational helping skills for implementing Caring for the Caregiver. So they're quite different, though of course some of the content would be the same because there are some things in Caring for the Caregiver that's supporting the caregiver to interact with their children, but the point of the manuals are different, but the way they would work together is you would use foundational helping skills to train the implementers of Caring for the Caregiver, the facilitators.
Okay, great. That's really helpful. I'm going to take this one actually for Ken. I hope this is okay to ask Ken. And I think it talks a bit more to this idea of how we train non-specialists, particularly outside of there being accreditation and things like that. So is it possible for people trained in this to be regulated by the Health Profession Council, especially in developing countries?
Yeah, thanks, James, and thanks for the question. It's a difficult question to answer. It's not something, I mean, I guess really these things are down to the individual countries. So when it comes to non-specialist providers, often in many countries, they're not regulated. There isn't a licensing body or a professional body, which is one of the reasons why we started on EQIP, because we wanted to find a way to improve quality of these groups who aren't necessarily regulated or licensed. So really, it depends on the individual country. Maybe there are some places where people would be regulated when they're non-specialists providing some sort of help. But really would also hope that just by using these approaches, we should hopefully improve quality. And this is one of the things about having the ENACT tool to measure things, that it gives us an ability to improve the quality. But it's a bit of a complex answer, and I guess it's really dependent on the individual country and the laws and regulatory bodies there. Thanks.
Thanks, Ken. We're running out of time, and there are some really big and important questions still in the chat that we'd really like to answer. I think what I'm going to ask, I'm going to pop my email in the chat. So if people do have questions, they can reach out. Particularly interested in questions about rolling out in a public education system. So for these questions, please do reach out, and we will be more than happy to advise. And I'll hand back over to Fiamma to close us, I think.
Yes, thank you so much. So I really wanted to thank you all for being here today, because this is a very special day for us, as we already heard. And thank you for giving us your time. Yeah, we have heard powerful insights from our colleagues, Ken and Anne, reminded us why this resource matters and who it is for. And James walked us through the manual itself. And Brandon and Ruta shared the evidence base that grounds it in science and practice. And we heard from Carmen also, who brought the voice of practical application through her video. So thank you for that as well. I think all these contributions kind of painted a beautiful picture of what the Foundational Helping Skills Manual truly represents. And I think we can think about it maybe like a bridge between research and real-world practice, and also, between the global development and a local application, and most importantly, between helpers and those they support. And I really want to acknowledge as well that this manual truly represents not just, a set of skills on paper, but a living bridge between the evidence that we have seen. And I think this is so extra special with EQUIP. Really, there is so much evidence in there. And so the bridge between evidence and empathy, between the science of what works and kind of the human connection that makes it meaningful. And so I think the FHS reminds us as well that kind of every conversation matters, and every pause and every act of presence, that you kind of plant a seed of safety and dignity in a way, for someone who is struggling. So this is really important that we don't forget this. We think that communication or empathy are so easy. They're not. So this really is important. So those are not small gestures. They're really the building blocks of trust and resilience and hope. So I want to thank all speakers and the organizing team, and you especially, for being here and for asking all those hard questions that make us better in what we do. For your engagement and really giving you now as an invitation this manual into your hands as a tool. So to practice, to share, to bring more humanity into every moment of support we offer and you offer. So thank you so much. And we're really happy to hearing back from you. Thank you. Have a beautiful day. Bye.
Bye-bye.
Bye-bye.